Hi, Jodie. Thank you for joining me today. So for my first question, could you please kindly begin by sharing a little bit about yourself? What are your passions and how did you become interested in epidemiologic studies?
So I started life as a clinician. I started off doing clinical medicine and training in pediatrics, and that kind of worked for me because I've never really been a grown-up, and I enjoyed working with children. But in thinking about the health problems of children, it became clear that a lot of the things that actually have benefited the health of children most come from public health, things like vaccines and seatbelt legislation, because children don't get to make their own decisions, but policies like that can be really influential to their health. So I was doing a clinical trials job in Oxford and had the opportunity to do some epidemiologic studies around Hib vaccine. And that's what got me into epidemiology and then modelling to try to understand why in the UK at that time, the vaccine program was not working as well as it had when it first started.
Thank you. Okay, so on to my second question. Through the rise of COVID-19, we've been accustomed to the modelling of epidemiological data. Do you believe research has become more accessible? How has the perspective on infectious diseases changed within society?
So, yeah, I think it's been a pretty extraordinary period to be a scientist and see the increasing role of science and epidemiology in public debate. And in fact, every other person's an epidemiologist now. So what I do isn't special anymore. That's great. But yeah, it was kind of invisible and nerdy, and it's still nerdy, but visible. And I think it's been really important in Australia, certainly in 2020 and 2021, the way in which science was very much visibly seen to be part of the decision-making process around the public response to COVID-19. And obviously there were scientists giving similar advice in many other parts of the world, and it wasn't taken on board, and different types of epidemiology unfolded. So yeah, I think it's been an interesting time and an interesting journey, and hopefully all of us have got better at helping to communicate that evidence to the public. It's something that I was encouraged to do early by my colleagues, and it's a constant journey to make sure we're doing it clearly and well and in a way that helps people understand why they're being asked to do things, certainly through the very challenging times in 2020 and 2021, and that helps them to feel calm and motivated to help to protect themselves and their communities.
Thank you. So your research also involves a collaboration with research institutes across Australia to promote healthy skin programs in remote northern Australian communities in order to reduce bacteria-induced skin and throat infections. Could you please provide insight into this program and your thoughts on how infectious diseases differ in rural and remote regions in comparison to urban, densely populated cities such as Melbourne?
Yeah, so that work that I've done in the past, and it hasn't been so much in the last couple of years on healthy skin, was really a great example of the way in which, long collaborations and long trust relationships and research data collection and other things can be extended and expanded. And, we were very fortunate, working with Andrew Steer at the Murdoch Children's Research Institute, who told us a bit about the work they were doing on Group A streptococcus and vaccine program, and we could sort of see the way they thought about that, and the models might be useful in helping to expand that. And that really opened the door to a whole suite of collaborators around the country, from Western Australia at Telethon Kids Institute, obviously up in Northern Territory, up in Darwin, up at the Menzies Research Institute, and groups who'd worked over decades with communities to try to help support healthy skin programs that would reduce the burden of scabies and skin sores, which, scabies is a really infectious and really itchy and annoying parasite, and that's something that impacts people's quality of life substantially. But Group A streptococcal skin infections can lead to late sequelae of heart and kidney disease, and are, in part responsible for the burden of rheumatic heart disease, which still exists in Northern Australia, and when we have the highest burden in the world. It's also a big problem in the Pacific region. So it was an example of meeting and being welcomed into a group of collaborators with existing studies and data, of, through appropriate governance processes, being able to access and reinterrogate some of those data to try to see if we could develop richer insights using modelling approaches. We also were involved in working with groups like the Aboriginal Birth Cohort Study that had collected long information on Aboriginal babies born in Darwin back 20, 30 years ago, and followed their lives through, and to understand more about households and social mixing patterns that might influence the spread of infections. And that work that we did to understand skin infections then was actually able to be repurposed and used for work to support COVID response, working in collaboration with the Aboriginal and Torres Strait Islander Advisory Group, who were working with us to help think through outbreak responses in remote communities, where we have issues about obviously entrenched poverty and disadvantage because of colonialisation, but also just people living in different family and community structures, different households, and understanding that and how that relates to the spread of infections, how people's underlying health conditions influence the burden of disease, and how important it is to prevent the spread of infection early and to help keep communities healthy and strong, because once people do become unwell, obviously that remoteness makes it much more difficult to access health services and resources. And so part of that work too was making the case for pre-positioning of antiviral therapies and other testing platforms and other things in remote communities to help initiate that early response.
Thank you. And on to my final question. Especially in our current climate, what are some key understandings that the youth of our society should recognise to combat and minimise the spread of infectious diseases?
So I think, 2.5 years into COVID, everybody's over it. And it's also, we've had this very strange sort of psychological transition from an era of mandation to one of personal responsibility. And everything's down to us to make decisions and initiate public health actions and do other things. And it's very difficult. I think people are very demotivated to even think about it, and often quite impacted in many ways by that whole experience. And we know there are a lot of mental health issues experienced by young people. I have teenagers, and we've all been through that journey together. So I think the sort of key things, it actually comes back to a First Nations woman, Lydia Thorpe, wrote a beautiful piece back in 2020, and saying, how do we get through these sort of terrible events, and how do we think about them, and how do we get beyond and process it, and saying, well, really it's the same way First Nations people have dealt with their experience. We need to focus on community and country. And so, that ability to think beyond ourselves, COVID's going to be mild for me, I'll be okay, I just want to get to this thing, to how does this impact on my wider community? How does it impact on people who might have a more severe experience of disease? But also going back to the drivers of COVID, this is a One Health problem. This is something that we've been waiting to have. The infectious diseases community has been talking about the risk of emerging infectious diseases, and just this year we've also had Japanese encephalitis virus, we've got monkeypox, we've got concerns about foot and mouth disease. We've not looked after our planet. We're highly interconnected, we encroach on animal environments, and these things are going to keep coming. We shouldn't despair about that, but it is definitely time to question the way that we interact with the world. I hope we can learn some enduring lessons from COVID and what has happened there. And obviously, global level, WHO and international health regulations, all these things are being reconsidered and thought about. But, that importance of community and country to have a safe and healthy planet and healthy communities and healthy individuals, we can't ignore that lesson. We can't just move on without really drilling down to some of the root causes and trying to make a better future.